Time now for the Business Spotlight on News Talk 94.7 and 970 WMAY. And today, visiting with Dr. Ankit Sharma of SIU Medicine. And something that I think plagues too much of society is type 2 diabetes. Dr. Sharma, what is type 2 diabetes?
Hi, thank you for having me, first of all. So type 2 diabetes is a disorder that disrupts the way our body uses sugar. So millions of Americans are affected by diabetes and is becoming an epidemic now. So I think it's important that we realize what the symptoms are and take effective measures to control it, prevent it, and treat it.
That's a good place to start. Tell us what some of the symptoms are and how someone might know if they're battling with this.
All right, I think that's a great question. First of all, sometimes people with type 2 diabetes can have no symptoms, and that's what makes the detection of diabetes sometimes challenging. But if you're lucky, then some of the symptoms, common symptoms are, number one, you may have an urge to urinate more often. Then you may have increased thirst, and sometimes you can have blurry vision too. But these are the common symptoms, but sometimes it's completely asymptomatic.
So why is this something that people should be concerned about if they start finding themselves with type 2 diabetes?
I think diabetes is a disease that can pretty much affect all your organ systems. So it's important that you catch it early and try to reverse it if possible, or treat it as effectively as possible.
Is there a way that I would know? You mentioned some of the symptoms, but is there something that would indicate to me that I might need to get checked?
Again, I think we always recommend that get yearly physicals. So if you have some risk factors for diabetes, your primary care physician can screen you for diabetes. That's one easy way to. There are simple blood tests now that can easily diagnose you with diabetes. So I think yearly physicals are important, and especially if you have risk factors like obesity or family history of diabetes. Those are some risk factors for you to have diabetes early on.
Now that we kind of have an idea of what it is, how can I keep it from happening? How can the listeners keep it from happening?
I think the most important thing is to control your weight. Diet and lifestyle modification is the most important thing in diabetes management. If we eat right and then exercise, I think that's majority of the battle. So as long as we can do that, I think we can keep diabetes away from us. And if we do have diabetes, then there are good treatment options available. And some people have this scare that diabetes means insulin, that I'll have to get shots, but that's not true all the time. If you catch it early, there are some oral drugs, that can help control your blood sugar. It's just, first of all, knowing that you have diabetes and then seeking help early on.
And by keeping my weight down, that might be a way to prevent it. But what are some of the treatments people should be aware of, in addition to maybe you mentioned some of the medicines?
Yes, oral medications like metformin. There are a group of drugs like glipizide, and there are new generation drugs too these days, which are pretty effective in treating diabetes. But again, the most important thing is diet and lifestyle modification. It not only prevents the symptoms, but actually it can reverse diabetes just by itself. I've seen people with bad diabetes who undergo extensive diet and lifestyle changes, and they reverse diabetes completely.
So it's something that can be reversed. That's great to hear. And if I go to my doctor, what kind of a test goes on to find out if this is something that I'm wrestling with?
All right, the simplest test is a blood test. Back in the day, you had to be fasting to get tested for diabetes, but these days there's a test called Hemoglobin A1c, which can test the average blood glucose for the last 3-4 months. So you don't have to be fasting at all, and we can still diagnose you with diabetes. One more thing that we have at SIU Family Medicine Clinic, we have a multidisciplinary approach to tackle diabetes. We have a diabetes educator in our clinic. We have a nutritionist, which is a key component to the management of diabetes. So besides the providers, we have this brilliant team that can help you with diabetes management.
Sounds like the bad news is it's a bit of an epidemic, but the really good news is it's very treatable and even something that you can reverse.
Absolutely.
Doctor, thank you very much for the information. That's Dr. Ankit Sharma, MD, from SIU Medicine here on the Business Spotlight on News Talk 94.7 and 970 WMAY. If you want some more information on that, you can go to siumed.org. Lots of important information there and ways you can contact the various doctors who can help you out at SIU. SIU Med, forward for you, here on the Business Spotlight on News Talk 94.7 and 970 WMAY.